name's David Pavely. I'm the Senior Health and Safety Consultant here at Pennington Choices. Welcome to this webinar today, which is part of a series covering health and safety and compliance issues. Today I'll be covering the link between compliance and health and safety. Well, first of all then, if you were to ask yourself the following questions. First of all, do you think you have clarity on your approach to compliance for the main areas such as fire safety, electrical safety, water hygiene, asbestos and gas safety? Do you think that your approach to managing compliance links into your overall approach for health and safety? Also, do you know what pitfalls to look out for? Then, why is it so important to have a strategic priority for managing compliance? Also, do you know which health and safety laws apply, and are you happy you're meeting their requirements? And finally, do you have access to someone to give you competent health and safety advice? What then is the link between compliance and health and safety? Well, primarily it's all about keeping people safe. And the three main reasons that are normally given for managing health and safety are from a moral, from a legal, and from a financial point of view. However, these three areas are all linked together. So, as a moral employer, it's reasonable that our employees should expect to come home from work fit and healthy. And then from a legal point of view, we should all have policies and plans that aim at the very least to meet the requirements of the law. Failure to do so could result in getting attention from the regulator or the HSE. And then finally, if things do go wrong, this could result in a legal case, which can have a financial as well as a reputational impact on an organisation. All health and safety regulations stem from the overarching act, the Health and Safety at Work Act 1974. And this act hasn't changed since its introduction, as it sets out broad requirements and principles and sets out the duties for a range of groups of individuals. It's important to note that whilst regulation and scrutiny is increasing, more and more the responsibility is falling onto organisations to make sure that they meet. This is shown, for instance, with the RRO, the Fire Safety Order. Also, there's a potential for lots of new regulation coming in. This is happening as a result of recommendations and a result of various reviews, particularly around fire safety after Grenfell. So what then does the Health and Safety at Work Act require, and how does this link to compliance? Well, the Health and Safety at Work Act sets out duties for employers, employees and directors for a range of people, and these requirements are set out within specific sections. So for instance, section 2, bracket 2, sets out the responsibility employees have for their employees. So an employer must provide safe plant and systems of work, safe use, handling, storage, transport of articles and substances. You're also required to provide sufficient information, instruction, training and supervision for your employees. You must also provide a safe place of work, including safe access and egress, and a safe working environment with adequate welfare facilities. And then also within section 2, but this is now paragraph 3, there is a requirement for an employer to provide a written policy with respect to health and safety at work for all of his employees. Section 3 then, within the Health and Safety at Work Act, is probably the key area for landlords, as it states that an employer must conduct their activities in such a way as to ensure, so far as reasonably practical, that persons not in his employment who may be affected by his actions are not exposed to risks to their health and safety. And so this includes the responsibilities that an organisation has for members of the public, visitors, contractors, trespassers, and of course, from a landlord point of view, the tenants. And so it is this section of the Health and and Safety at Work Act that covers how a landlord is required to ensure the safety of tenants and visitors. Indeed, looking back over the top 10 prosecutions in 2019, around half were for Section 3 offences, and many included hefty fines when members of the public, tenants and contractors were put at risk. So obviously it's very important in 2020 that you avoid finding yourself in that situation. What then role does the health and safety policy play in linking health and safety and compliance? The Health and Safety at Work Act says that every organisation must have a health and safety policy, and this must be shared with employees. When we go around and visit organisations, we seem to come across the same sort of issues again and again, particularly around health and safety policies. So I was going to share with you today some of the regular pitfalls that we come across. One of the regular things that we come across is the fact that the health and safety policy is not up to date. They tend to get written, then they tend to get put away somewhere and then gather dust, normally in the health and safety manager's office. So it's a good idea for a health and safety policy to become a living document, one that is regularly being reviewed and updated and amended as things change within your organisation. I've found in the past that it's a good idea to make notes in a master copy somewhere as you go throughout the year, and then when it comes to the annual review of the policy, whatever time of year you decide to do that, all of those changes can then be implemented, and that way you don't miss anything off. Also, very often the statement of intent is not signed off by the most senior member of the organisation. Sometimes we see this delegated to the director responsible for safety, whereas as the statement sets out what the organisation commits to do, it is far better if the person at the very top signs it off. In addition, sometimes this main policy document, when it is updated, it doesn't then get published and distributed around on notice boards. So we find as we go and visit premises, there might be a policy statement displayed, but it might be a couple of years old. The health and safety states that you must share the health and safety policy or any changes to it with your employees. The first opportunity to tell your employees about the policy is during the health and safety induction. All employees should receive induction training, and during this training they should be told where to access the policy and how to raise any health and safety issues. So before we look at the specific compliance areas, I thought it would be worth sharing some thoughts on some issues that will be affecting us in the future, particularly around Brexit. So according to the Health and Safety Executive, your duties will not change with Brexit. The advice of the HSE is that organisations should continue to follow their guidance, and organisations should continue to manage risk in a proportionate way. There will be some minor amendments to remove EU references from our health and safety law, but legal requirements will remain the same as they are now. Indeed, whilst we've been a member of the EU for decades, the main health and safety statute in the UK, the Health and Safety at Work Act 1974, was introduced before we joined the EU. And the Act has been fundamental to the UK in us obtaining our position as a world leader in health and safety. Therefore, it's very unlikely to expect that Brexit will lead to a reduction in health and safety, as these are largely underpinned by the Health and Safety at Work Act. So now let's have a look at some pitfalls that we come across from a compliance point of view. Well, one of the commonest things that we come across when we visit organisations, look after properties, is that one of the most areas that is left out is commercial properties. We tend to find that there's sometimes some ambiguity about who's responsible for them. So we would recommend that the first thing to do is to undertake stock condition compliance audits to identify which properties should be subject to which compliance inspections. Following on from this, you should then undertake the required compliance inspections and the follow-up work that comes out of those, or ensure that the leaseholder or managing agent does this. And obviously then you need to make sure that there's a robust data recording process to make sure there's a record that all of these compliance actions have taken place. The next pitfall that we come across from a sort of general compliance point of view is data validation. We also find that many housing associations, particularly the larger ones, do not have a full picture of their property portfolio. Therefore, we would suggest a data validation exercise right at the start will be very valuable. This should include the following 4 stages. Firstly, download the full asset list from your data source onto an agreed validation format. Then confirm which properties will or will not be subject to each compliance regime, and make sure you record this. All properties should be defaulted as requiring an action at the start of this process until it can be evidenced that they don't need help. They can then be taken off the programme. Next, validate a sample of compliance records to check that they are valid and in date. You'll need to decide what sort of size of sample to look at, depending on the size of the portfolio or the size of portfolio of properties, I would suggest. And then finally assess the compliance gap in order to formulate an appropriate catch-up. Okay, that's sort of some general compliance thoughts. Now let's have a look at some specific compliance issues. First of all, gas safety. Under the Gas Safety Regulations 1998, the organisation must ensure that an annual gas safety check is carried out by a qualified gas safe registered engineer to ensure that all gas installation pipework, gas appliances, and basically anything other than the tenant's own appliances, so that includes flues as well, serving those appliances are maintained in a safe condition. Records must then be kept for 2 years, and a copy of the Landlord's Gas Safety Record, or LGSR, issued to the tenants within 28 days. In communal buildings, the organisation must display the gas safety record in a prominent place within the premises. Next then, from a fire safety point of view. So, in accordance with the Regulatory Reform Fire Safety Order 2005, organisations must carry out fire risk assessment, or FRA, on all communal parts of its properties, based on the risk assessment of the building, and that includes its occupants. The FRA must be kept up to date through periodic review in a timescale appropriate to the premises and appropriate to the level of risk. The organisation must action and evidence the completion of all the actions that come out of the fire risk assessments to make sure they're recorded. So as well as that, you should ensure that your FRAs are PAS 79 compliant and the person carrying out the fire risk assessments is competent. It's a good idea to use fire risk assessors who are accredited with a third party, such as BAIF, IFE, UCAS or NEBOS. If you are using your own in-house fire risk assessors, make sure there's some form of quality and audit process in place to control and assure the level of quality of what they're producing. Next then, water hygiene. The control of substances hazardous to health regulations, or COSH 2002, provides a framework of actions to control the risks from a range of hazardous substances, including Legionella. The approved Code of Practice L8 has been produced to help duty holders comply with their legal obligations. Organisations have a duty to carry out a Legionella risk assessment, or LRA, to identify and evaluate sources of exposure to Legionella bacteria, and best practice is every 2 years. There's a requirement to regularly review the Legionella risk assessments and make necessary changes as a result of the review. Duty holders are also required to produce a written control scheme. This is a set of operating procedures that, if implemented and suitably monitored, will prevent, reduce or control the risks from Legionella. Appropriate records of risk assessments, maintenance work and test results must also be kept for at least 5 years. Next then, let's have a look at asbestos safety. So So in accordance with the Control of Asbestos Regulations 2012, organisations have a duty to manage all non-domestic premises, for example, communal blocks and offices, to find out if there are any asbestos-containing materials within those premises. The organisation is required to carry out an initial asbestos management survey, followed by periodic asbestos re-inspection, typically annually. Where ACMs are found to be present, the business must prepare a written asbestos management plan, which should be subject to a periodic review. And this should be kept up to date, make sure you keep an up-to-date record of the location and condition of asbestos-containing materials, and provide this information to anyone who is liable to disturb these materials, such as residents or such as operatives who might be working in those buildings. Next, let's have a look at fire safety. The Landlord and Tenant Act 1985 requires that the electrical installation in a rented property is maintained in a safe condition throughout the tenancy. To demonstrate compliance with this and other legislation, including the Health and Safety at Work Act, as we were talking about, the requirement to look after people through Section 3, also through the 1989 Housing Act, the Electricity Work Regulations 1989 and the Housing Act 2004, the organisation should adopt periodic electrical inspection and testing programmes to produce electrical installation condition reports, or EICRs. The Management of Houses in Multiple Occupation England Regulations 2006 requires that every electrical installation in a house of multiple occupation is inspected and tested at least every 5 years. Although some guidance directs that in domestic properties periodic electrical inspections should be undertaken every 10 years as a very minimum, the recent Code of Practice for the Management of Electrotechnical Care in Social Housing recommends a 5-year programme for domestic properties. And British Standard BS 7671, the requirements for electrical installation, also recommends a 5-year frequency for commercial properties. So, having looked at each compliance area and what you'd be required to do under each of those, they're all basically linked together or underpinned by the way your health and safety culture operates within your organisation. So what then do we mean by a health and safety culture? Well, it's very important that organisations have an open and robust culture. And when we say a health and safety culture, there's lots of different definitions of what it can mean. The one I quite like is the one from Lord Digby Jones, which is it's the way we do things around here. In other words, in a good organisation, health and safety should be given the same priority as all other areas of the business. But for a strong culture, it's important that a number of key features are in place. First of all, it is important to be open and honest and to learn from mistakes. It's important to have commitment from the very top of the organisation, all the way through, from the top, all the way through to everybody else. But this can only be achieved with effective communication throughout the organisation. What this results in, then, is to have a shared view of risks of what is acceptable and what is not acceptable. This then means that everybody throughout the organisation should take ownership for their own particular area, for themselves and for other people as well. But I suppose ultimately it's about a balance. It's about a balance between getting your health and safety management right, but also, most importantly, still being able to do the task at the end of the day. So, in summary, when we talk about compliance, we talk about health and safety, it's all about the same thing. It's all about keeping people safe. It's about looking beyond the legislation, and it's so that if you were to ask yourself, are you doing everything reasonably practicable to keep tenants safe, you can sleep at night knowing that you are actually doing all of that. To achieve this, you may need to change what you're currently doing. You may think you need to improve the way you currently operate. If you do, it's about setting yourself a clear vision with a plan in order to try and achieve that. It's about getting on with it now, making a start with it now, and this is an ideal opportunity with people perhaps with a bit more time working from home to be able to focus on things they may not have had a chance to have looked at for a while. It's about putting money aside, but it's about making a start on it as soon as possible. In order to achieve this, it's about strong leadership. It's about setting a strategic focus, and it's about deciding within your organisation what level of risk you're willing to accept, and then making sure that you have resources available in order to achieve what you need to be doing. It's about having a clear policy framework that enables you to make decisions in a systematic way and be clear about what it is that you need to do. So this now concludes my webinar on health and safety and compliance. If you'd like a copy of the transcript of this webinar, or indeed any help or advice on your approach to compliance issues, please contact us at Pennington Choices, and we'll be very happy to help you. We've now had a number of questions that have come through whilst I've been giving this presentation, and I'll just want to answer those for you. So I had a lady called Sue who's asked the question, what would you expect to find in a good health and safety policy? Well, the health and safety policy is a format as set out within HSG 65, the HSE's guide on managing safely. Within there's advice on what you would put in a policy. Basically, the format is to have a policy statement right at the very start, which sets out the organisation's commitment to health and safety. You then explain how you organise yourself. In other words, what is your health and safety management structure within your organisation? Who does what? Who's responsible for what? You then have, within the arrangement section of your health and safety policy, all the details of how you actually achieve what it is that you want to do. And it may be that you want to put the arrangements within your health and safety policy, which ends up with quite a large document, or it may be the best approach would be to have headings within your policy around each of the various compliance areas, and then they would refer to policies which would contain all of the detail. I've had another question from Emily. This is what is meant by competence. Obviously I've mentioned about the need for access to a competent person. Well, there's a range of different definitions of what competence is. It's generally around somebody having sufficient knowledge, skills and experience to be able to understand and manage health and safety. Probably the biggest requirement is to make sure that people know their limitations and they know what they can, what they can't do, and they know when they would need to go for external support. And then I've got another question here from Mike. Mike's asking then what sort of qualifications someone would need to be a competent person. So there's a number of qualifications, but if someone's got a health and safety management course, so the IOSH Managing Safely course is a good qualification for people that are managing teams. The qualifications around the leadership of a team, of an organisation, for them to understand their responsibilities and duties. And again, there's an IOSH leading safely qualification. But there's a range of courses. There's also the Working Safely, which is a good course for people who are at the coalface, if you like, working away, so they understand their duties and responsibilities and they know how to look after themselves. Okay, that concludes all the questions. Thank you very much, and thank you for your time.